Welcome to CES 2021, and thanks for joining us today. I'm Randy Kellogg, President and CEO of OMRON Healthcare. As those who follow OMRON Healthcare can tell you, our team has invested in innovation for new tools to measure and manage blood pressure. In the last 3 years, we've introduced the first wearable blood pressure monitor and the first blood pressure monitor with EKG in a single device for use at home. More importantly, we've delivered on what we've promised. The technology we've shown here arrived in the market as FDA-reviewed medical devices, meeting the highest standards for performance and accuracy. And we've seen our technology have measurable, meaningful impact on consumers who rely on us to manage their hypertension and to gain important insights from a complete picture of their heart health. As we've looked around CES last year and this year, we can see that OMRON has transformed the global heart health marketplace. There are more wearables, there are higher standards of accuracy, and there are more health devices that take lifestyle into consideration. That's a good thing. That means more lives can be saved. This year at CES, we have an important announcement to make about what we are doing to serve and save those who are near the higher risk levels on the hypertension scale. Before we share those with you, I want to emphasize our why we are here, why we are making these announcements, and why we work so diligently to deliver on what we promise. Our mission is going for zero heart attacks and zero strokes. Going for zero is at the heart of everything we do. Going for zero is a big, bold mission, and it has to be because the challenge is enormous. 1 billion adults globally are hypertensive. That includes 116 million adults in the United States. Of that 116 million American adults who are in the hypertensive range, more than 37 million of them have uncontrolled stage 2 hypertension, leading to greater risk of heart attack and stroke. Hypertension comes with a higher risk for heart attack and stroke, and it's also a leading underlying health condition for greater risk of complications from COVID-19. For those at the higher end of the hypertension scale, that risk is even higher during this pandemic. In fact, recent reports have shown that heart attack death rates have more than doubled during the COVID-19 pandemic because fewer patients are going to the hospital when they're experiencing symptoms. This is alarming. It means that many of these patients are not visiting their doctor during this pandemic and managing their hypertension. It means that the heart attack and stroke fatality rate, which is already at crisis level, is even higher now. If you've heard me speak before, you know that I've talked about 80% of heart attacks and strokes are preventable, and that requires active management of one's condition. So this year at CES, we're introducing our first remote patient monitoring service from OMRON. It's called VitalSight. It's designed specifically for hypertension management. OMRON created VitalSight for more active condition management and more patient-to-physician dialogue. If you're one of those patients, we've created VitalSight to help you live a longer, healthier life. We created it to save your life. I'm joined by Jeff Ray, OMRON's Executive Director of Business and Technology, who will tell you more about VitalSight.
Thanks, Randy. At OMRON, we talk about going for zero every day and in every meeting. We are probably one of the few companies where each and every employee can tell you about our mission. And as Randy said, 37 million adults suffer from uncontrolled stage 2 hypertension. They live with higher risk of heart attack and stroke and need more support to manage their condition. The risk that these patients live with every day has become even bigger over the last year during the COVID-19 pandemic. With the healthcare system overwhelmed and with patients missing their regular appointments, their management of hypertension has been jeopardized. Even worse, recent reports have shown that heart attack mortality rates have more than doubled during the pandemic, with fewer patients going to the hospital when they're experiencing chest pains or other symptoms. This is really scary for those with high blood pressure and for those of us in the business of heart health. Going for zero means helping those at greatest risk of heart attack and stroke. We've been working to develop our own remote patient monitoring service for some time, and now we're rolling it out with our very first health system partners. And VitalSight is the first remote patient monitoring service from OMRON Healthcare. With over 40 years of category study and innovation, OMRON is the global leader in blood pressure monitoring and personal heart health technology. So we felt it was our obligation to create a remote patient monitoring program for hypertension. And what makes VitalSight unique is that it is specifically designed for hypertension management and developed to foster greater patient-to-physician communication and data sharing. This has been shown to improve treatment engagement and health outcomes. VitalSight is an easy-to-use service that physicians can use to enroll patients with high risk levels of hypertension, and patients receive a kit delivered to their home that includes an OMRON connected blood pressure monitor and data hub. These are preset to securely share measurements with the patient's physician and care team. VitalSight can then be integrated directly with the clinician's electronic medical record system, also known as an EMR, or through OMRON's doctor dashboard. VitalSight sends automatic notifications through the EMR that signal when a patient has readings that indicate if action needs to be taken. And because VitalSight fosters stronger patient-to-physician communication, it helps to focus the care team on urgent patient health data so they know when action is necessary. Doctors can also personalize blood pressure thresholds for each patient and receive alerts for high readings. Those alerts and readings integrate into the doctor's EMR or OMRON's doctor dashboard. There are also printable reports available through the doctor dashboard to show patients more information about their condition and motivate them to make healthy behavior changes. OMRON is partnering with the most forward-thinking hospital systems and independent physicians in the U.S., including places like Mount Sinai in New York and Northwestern Medicine in Chicago. Early feedback from physicians shows that VitalSight is quickly helping doctors improve engagement with patients on their treatment plan. Northwestern is now conducting a clinical study of VitalSight and the outcomes that we can achieve with this service. Dr. Stephen Purcell is the director of the Institute for Public Health and Medicine at Northwestern, and OMRON is working with him and his team, and we've now invited him to share why they have chosen VitalSight and what they are seeing so far with the service.
The next really exciting thing is that because Medicare now supports remote physiologic monitoring along with remote management, we can use that information to assess patients' level of blood pressure control. This could be used also in heart failure patients where you might be monitoring weight and blood pressure, and then have interactive communication with patients and modify their treatment plans as needed to reach their clinical goals, and do that even multiple times over the course of a month or two, so that you can make multiple small changes, you can advance medication adjustments rapidly. And for patients, it's fewer visits to the office. I mean, I think we're all looking to avoid trips to the office during the time of the COVID epidemic. But I think even before we were dealing with COVID, we realized the burden of multiple frequent office visits for doing something like adjusting blood pressure medication. So this gives us a set of tools to get the information directly into our record, to interact with patients, and then to make adjustments and then track their level of control.
Thanks, Dr. Purcell. We knew that physicians and their patients were looking for an easy-to-use, accurate service. So we made VitalSight simple, easy, and effective. Once patients receive a kit delivered to their home that includes an OMRON connected blood pressure monitor and data hub, they can immediately start using VitalSight, knowing they are securely sharing their health data with their physician and care team. So it was important that we made the VitalSight kit plug and play and ready to use right out of the box, without the need for Wi-Fi or any separate cellular connection. And if you've been following OMRON over the past 3 years, you know that we have invested in developing tools to gain a more complete picture of heart health data and to safely store, track, and share that data so it can be used to enhance treatment plans and to work to improve health outcomes. To talk more about that, I'd like to introduce my colleague, Andy Atwell, OMRON's Executive Director of New Business Development.
Thank you, Randy, Jeff, and Dr. Purcell. At OMRON, we believe more data is better, and we believe that patients will be more motivated to participate in regular monitoring to manage their hypertension and to change their behavior if they know what their data means. That's why we have developed multiple apps to do that and made data insights a key component of VitalSight. We also believe that data can save lives. One of the most important parts of VitalSight is the capability to detect trends and changes in heart health data and to flag the most urgent data points to the physician or care team so they can take action. When we were developing VitalSight, our team collaborated with physicians and care teams to understand the barriers that prevented them from taking advantage of remote patient monitoring in their practice. A few themes came to light. First, hospitals and independent physicians wanted a service that was easy to use and easy to integrate into their current technology rather than add to their workload. Next, remote patient monitoring services had to be cost-effective for both the hospital and for the patient. And most important to our Going for Zero mission, this service had to result in real impact on patient health outcomes. To study the various impacts of VitalSight, our team worked closely with healthcare provider Highmark in Pittsburgh during our beta testing. Together, we aimed to help clinicians assess the characteristics of hypertension and to risk stratify patients. High-risk patients could then be identified for earlier intervention, potentially resulting in improved health outcomes and an overall reduction in the cost of patient care. With the test now complete, both Highmark and OMRON were excited by the results. To review the latest information, please be sure to check our press kit. And now I'm honored to introduce Jane Sarasan-Khan, renowned health economist, advisor, and writer of the Health Populi blog, to talk more about the economics of VitalSight and remote patient care.
I think what's very exciting and timely about this as a service/product like VitalSight is that it bridges the consumer, patient, caregiver with the healthcare provider. And that brings everybody into alignment for one key mission, the better health of the patient, the outcome. So when we have that alignment between the person in self-care, owning their healthcare, having more control and self-efficacy and confidence about managing it at home, and then the provider armed with data from bits and pieces of the VitalSight experience, the blood pressure cuff, the weight scale, data moving through the cloud, through the algorithm to the provider, who then can see, oh, Mrs. Jones may have gained some water weight today, or her blood pressure's through the roof, or what have you. So that in real time, these the supply side of the provider and the demand side of the consumer come together through something like VitalSight. And that's a beautiful thing because we prevent emergency admissions, we prevent inpatient admissions, and we prevent even preventable visits to the doctor's office that Mrs. Jones may not want to make because, again, she wants to save time, have convenience. Maybe she can't get to the doctor's office, or, of course, in the era of the coronavirus, stay away from the brick and mortar healthcare office or hospital clinic. So I think it brings people into alignment, both the patient and the provider side, because we love our doctors, but we don't need to see them all the time. And they don't want to see us all the time either. So in this increasing value-based environment for the payment of healthcare, self-care at home is one of the keys to providers taking that on. So it's really a win-win in terms of financials for both the patient and the doctor, patient experience in that I can stay home and take care of myself, and for the physician, really the benefit for his or her workflow to focus on patients who need to be in the office, the sickest patients, the patients who need that one-on-one, face-to-face, real time. So I think it totally is a win-win, and it brings a new era of empowerment to patients and greater satisfaction for clinicians, which Lord knows right now clinicians really need in an era of burnout.
Thank you, Jane and Andy. We are so excited about VitalSight and the strides this will help us make in Going for Zero. As we pursue our mission, OMRON is tapping into the power of over 40 years of category research, remote monitoring experience, physician insights, and consumer feedback. Developing technology that encourages behavior change requires real study of the market, our consumers, and how we can help them. OMRON is the #1 doctor and pharmacist recommended brand of blood pressure monitors in the U.S., and we know we have to work hard and keep our promises to stay #1. We know that leading the category and going for zero both come with a solemn responsibility. So let's take a look at the promises we've made at CES, how we've delivered on them, and then the updates we have now. 3 years ago, we introduced HeartGuide, the first wearable blood pressure monitor. HeartGuide transformed the idea of what a blood pressure monitor could be. Our team spent years designing this technology in the form of a wristwatch with an oscillometric cuff built right into the wristband. The same technology that's in the doctor's office is now available around your wrist to ensure an accurate reading of your blood pressure with insights on your heart health provided through the accompanying Heart Advisor mobile app. Since it arrived in the marketplace 2 years ago, HeartGuide has drawn high consumer demand and prestigious accolades as a breakthrough medical device. HeartGuide was named by Time magazine as one of the best inventions of 2019 and a top medical breakthrough by Prevention. CNET declared HeartGuide an Editor's Choice winner, and Engadget deemed it a Best of CES award winner. We created HeartGuide to recast how a blood pressure monitor can look and what it can do. We created HeartGuide as a blood pressure monitor that could be part of a daily lifestyle and help create a habit of regular blood pressure monitoring. Last year, the CES spotlight was on Complete, the first blood pressure monitor with EKG capability in a single device. We created Complete to help serve those who must manage irregular heartbeat, or AFib, a condition that comes with 5 times higher stroke risk. We also created Complete to help anyone who has a family history of irregular heartbeat or suspects they may have the condition. Irregular heartbeat is notoriously difficult to detect because, well, it's irregular. A checkup at the doctor's office can often miss it. With Complete, anyone can easily monitor for the condition at home. Complete won a CES Innovation Award in 2020 and was selected as a winner of Prevention's prestigious Wellness Award. Consumers who have purchased Complete tell us it gives them greater peace of mind to know that they have a more complete view of their heart health and a greater sense of how to manage their condition. Some of our customers have said it couldn't be easier to use, and the app makes it so easy to keep up with your stats. Even my doctor was impressed. And the best machine ever, everything all in one. OMRON is now expanding availability of Complete, and beginning in March, consumers in several EU countries, as well as Japan, will be able to purchase this product. Complete and our other connected blood pressure monitors sync with our OMRON Connect app, where users can store their data, track it over time, and then share it with their doctors. At OMRON, we believe that more data is better. And we've been exploring ways to use data to foster greater patient-to-physician communication for better condition management. At CES 2021, OMRON is introducing new tools to meet that goal. We are happy to share updates for our new OMRON Connect 2.0 mobile app, which will serve as a personal heart health coach with expanded insights, real-time coaching, and incentives for behavior change. Our current apps, Heart Advisor and OMRON Connect, will merge into OMRON Connect 2.0, vastly increasing the value of every OMRON connected blood pressure monitor. All OMRON connected devices, including HeartGuide, Complete, and our recently redesigned line of blood pressure monitors, will pair with the new OMRON Connect. This intuitive app is designed to foster patient-doctor dialogue, advance heart health education, and provide personalized insights based on daily activities and lifestyle. Users can securely store their data, track it over time, and then share it with their doctor. OMRON Connect 2.0 will include an option for users to sync data with both Apple Health and Google Fit platforms to integrate reports on heart health, activity levels, and even sleep quality. The app will feature a premium option for a small monthly fee that will give users access to heart health report cards and rewards. Users can earn rewards through regular monitoring and behavior change. The rewards can then be exchanged for retailer gift cards. As Randy said, our connected heart health technology is designed to encourage behavior change. That is the path toward going for zero. We've heard from numerous customers that HeartGuide, Heart Advisor, Complete, our line of connected blood pressure monitors, and the OMRON Connect app have all helped them stay on their medication, eat healthier, get more exercise, and even quit bad habits. One of the most powerful consumer testimonials we have heard came from Frederick Goodall, who we've had the pleasure to work with on several of our consumer education efforts. Frederick was involved in our 90-day program where we taught consumers how to create a habit of regular monitoring and then make it part of their lifestyle within 90 days. I'm proud to introduce Frederick to all of you.
I do believe OMRON saved my life because when I started working with OMRON, measuring my blood pressure was not a part of my daily routine at all. Maybe if I went to the doctor once a year, I'd get my blood pressure measured at the doctor's office. But it's not something I even thought about. It's not something I even was concerned with. And to tell you the truth, if I had to do it by myself, I wouldn't really be able to tell you what those numbers even meant. I just go to the doctor. He says, your blood pressure is good. I'm fine. Or he'll say it's a little high. I'm like, okay, I'll do something different. But just having a deep knowledge of what those meant and how those affected my real health is not something that was in my toolkit before I started working with OMRON. OMRON has shared a lot of knowledge with me about heart health, about measuring your blood pressure, about different lifestyle changes, not just with the actual devices, but going to the website, going to the blogs, looking at the information you have from doctors and from experts. All these things have taught me a lot. So when I say OMRON saved my life, man, I really mean that.
Wow. Thank you, Frederick. We're proud of you and grateful for what you've taught us and how we can serve others. Frederick and patients in the higher risk territory showed us that we had to make strides to reach those with uncontrolled hypertension and give them more tools to manage their condition.
Thank you, Carol, and a special thank you to Frederick for sharing his incredible story of going for zero with us. We're excited to introduce VitalSight and to work with more health system partners across the country to serve patients who need this service for management of their condition. Here at CES, you've heard me talk about the value of partnerships in our Going for Zero mission. We continue to seek like-minded partners who believe that going for zero is possible. It's a bold mission, and we know we cannot do it alone. OMRON recently announced additional investment into our partnership with AliveCor, the market leader in AI-based personal EKG technology. Our alliance with AliveCor will help us enhance our current heart health technology portfolio and provide hypertensive patients with data that can save lives, a complete picture of their heart health that can be achieved with personal remote monitoring technology used at home. We continue to explore and develop new technologies and digital applications that can coach users on how to monitor and manage their heart health, and we will engage partners like AliveCor to ensure this technology is best in market. OMRON's expanded investment into AliveCor builds upon the two companies' ongoing collaboration. Last year, OMRON and AliveCor announced a global strategic alliance to improve access to remote patient care for 70% of the global population. This alliance was created to facilitate remote patient monitoring while reducing patient and healthcare provider contact during the pandemic. Recently, the U.S. Surgeon General, Jerome Adams, issued a call to action for hypertension control as a national public health priority. Long-standing health disparities are contributing an even higher risk of hypertension in underserved communities, with statistics showing that among U.S. adults with hypertension, 80% of Hispanic and Black Americans have uncontrolled high blood pressure. OMRON responded to this call of action with our national education and outreach effort. Addressing health disparities is a priority for OMRON and for our Going for Zero mission. We've partnered with the American Heart Association for several years now to address the heart health crisis in Black and Brown communities. We've taken a lead role on the Heart Walk in Chicago, where we are based, and hosted blood pressure monitoring events in underserved communities to bring resources to the residents and to listen to the top needs to address resource gaps. OMRON has donated blood pressure monitors, which have been distributed to community health centers through the AHA's Target BP program. And we've collaborated recently with Walgreens to donate trusted OMRON blood pressure monitors to the University of Michigan for a hypertension program led by the STEER HD initiative. It's providing underserved communities in Michigan with the blood pressure monitoring and hypertension treatments they need. And we look to VitalSight and our work with health systems in these communities as a core pillar in our efforts to bridge health gaps and save lives. We will have more updates and more announcements on these efforts and our new offerings. You can follow OMRON News on Twitter, Facebook, LinkedIn pages. And I invite you to connect with any of our team members here at CES to answer your questions and provide more information on what we've shared with you today. Thank you for joining OMRON at CES 2021, and please take care of your heart.